I just want to give you an update. We're at day 187 since the incident of the aneurysm. Since last we spoke, we left the hospital and wound up going to a rehabilitation facility in Jacksonville, a place called Brooks Rehabilitation, where Corey had been able to start working physical therapy, occupational therapy, 3 hours a day. She went from being able to move just one hand to now moving her whole left side, partially moving her right leg. 2 days ago, she started moving her right arm just a little bit. She's talking. She's trying to now talk in full sentences, albeit it's a little bit off. So you have to, you know, try again a few times just to see what's being said. Um, Memory issues are there, so be patient. Um, you know, we've been home now roughly a month, just over a month, and things are pretty good. She's had a couple of breathing issues, but she's breathing on her own now. She doesn't need a machine anymore. A couple of breathing treatments here and there. Um, she's getting out of bed more, with help, of course. She can't walk yet, so I'm manually having to pick her up, and my daughter's helping with everything. Um, to put her in a recliner chair, her wheelchair. Yesterday we went and seen a neurosurgeon that performed majority of the work. He is absolutely ecstatic with how she's progressed since we left the hospital, but we have had to go back to the hospital a couple times. One was for a breathing issue about 2 months ago, or a month and a half ago, which I think we now learn that she has sleep apnea. We've been using something called Check Me O2, and it's Bluetooth, wireless, rechargeable, comes right to your phone when you're home within range. It's working pretty good. It gives you your oxygen level, your pulse rate, if she has any motions. But she's doing really good with the span. Do want to talk to you a little bit about the equipment that was sent from the insurance company, like the bed and the Hoyer lift. The bed, what a piece of garbage. If you can fight to get a better one, do it. We had to get extended side rails because she decided one morning that she wanted to get up to walk the dog and decided to slide out of bed. Um, so we had to take her to the hospital, verify everything was good there because she seemed like she hit her head and kept complaining of pain in her head. Um, the Hoyer lift, it's a manual Hoyer lift, just like a hydraulic jack, and it doesn't fit anywhere. It's literally sitting in my office right now because I can't use it really to do anything. Can't get her in the shower with it. Bathroom's too small, doors are too small. Can't get her in the tub with it. So definitely look for other options to do that because you need to bathe. Definitely have to bathe. We found some really good baby wipes made by McKinnison. Um, they have aloe vera, and my sister-in-law had sent them down, and my niece, and they work really good. It's really good on her skin. You know, no reactions to it at all. So it's working really good. Plus, utilizing some zinc from sitting down on her butt too long. Make sure you have that stuff. Um, time your medications. We actually were able to cut down some medicine that she's been on with the help of the neurosurgeon and the primary doctor. It's been a mission for at home, with dealing with multiple agencies trying to get um, medical equipment. Everything's an issue. We had to find a new ENT that deals with trach. So he wants to start decannulation process soon. So we have to get that ordered through the at-home company that ships everything to the house, along with her food and stuff like that. So keep a count, keep a log, keep up to date, deal with your doctors as much as possible. Um, but things are moving in the right direction. Very happy with progress. Of course, we wish it was more, but things are slowly getting there. We're in an opportune time of 6 months to a year of how things progress. So the other thing is have patience. Okay, definitely have to have patience because there's a lot of stuff that's going to get you. Whether it's family and friends coming over, um, aggravation, agitation, the pain, the neurological pain that she gets on the right side. Work with that. We've been working with Tylenol quite a bit. We're going to up her baclofen just a little bit because when she started moving her right leg and she was able to bend it and do all this stuff, now she's being spastic with that right leg a little bit. Happens a couple times a day where the quadriceps tightens up and she can't release it for a while. It causes quite a bit of pain. So we're looking for a neurological orthopedist and still looking for a speech therapist. There's really none in our area here where we're at right now, and definitely not nursing care. Nurses, we get a call the nurse if we need something, which is never. Um, so getting nursing care to somebody to come in and help my daughter for me to go do something like just to get a haircut is not going to happen. Um, Family and friends. That's what you have to count on, and you got to get it. You have to have help. Can't just be one or two people. So work that community the best you can. There's some nonprofits you can look into. We've not been able to find what we need for help in our area, but there is the fire department liaison has been trying to help us quite a bit. Really nice guy. Been calling every so often to help whatever we can get. But personal note, haven't been able to go back to work. I have an appointment tomorrow with the doctor to adjust my medication some more. But also in a lot of pain, physical pain myself because of having to lift her and move her because of that Hoyer lift that they send is just outright garbage. The transfer chairs that we have and we purchased, everything's out of pocket because of course insurance doesn't cover half of the stuff you'll need. They're either too hard, too big. Um, they just don't sit right for your loved one. So try and find what you can. We're working to try and find something to transfer from the toilet itself to the shower that's not too big, not too heavy, and that's going to work for the bathroom we have. It's been very hard to find something that's not too big. Um, you know, our doors are roughly 22 inches with the door on. The door frame itself is about 24 inches, and the stuff that you need is going to be bigger than that. So really, you're going to have to build around and make work what you need. But yeah, so that being said, I mean things are doing good, and I hope it gets even better. So we'll catch you on the next one.